Hi, I'm Dr. Herbert Robinson, and I'm here at North Oaks Health System, where I'm a family practice doctor and in private practice. I'm also the Chief Health Information Officer at North Oaks Health System, and today I thought I'd talk a little bit with you guys about sepsis. This is National Sepsis Awareness Month, and this is an excellent occasion, we feel, to educate people about sepsis. You know, we find that more people often have heard about Ebola or some of these more rare diseases that people may get than they've heard about something so common as sepsis. And we think it'd be an important part of helping take care for our patients with sepsis as to educating them as to the signs and symptoms of sepsis when they're at home and in the community, so that we can help treat them in a more reasonable fashion. Believe it or not, in our community we'll have hundreds of people that will become septic every year. Nationally, over 250,000 people die from sepsis annually. That's more than breast cancer, prostate cancer, and HIV combined. I think we all know and are aware of all the screenings that people do for breast cancer and prostate cancer and HIV, but people aren't very aware often about sepsis and ways that it can be detected and the signs and symptoms related to that. Sepsis itself occurs as the body's response to an overwhelming type of response to an infection. Those types of infections can be in any part of the body. They may be in the urinary tract, they may be in the respiratory system, they may be in the skin, they may even be in the throat. Often when people start to become ill with an infection, they'll have some symptoms of discomfort. With sepsis, the body typically responds in an overwhelming fashion to an infection that hasn't been either well localized or contained, or that your body just has an extreme reaction to having an infection. When that happens, other things happen in the cascade that cause you to get sick more rapidly. As many of us know, we may get a sore throat, it may last for a few days and go away. People who get sepsis may start out with a little bit of a cough and develop to some fever and rapidly get other symptoms such as feeling faint and feeling the fever and chills and generalized aches that can be quite painful, that will often show that there are other signs of the infection being worse than just your common infection. The interesting thing about sepsis is that anyone can actually get it. Now, it is more common in patients over the age of 65 and in children under the age of 1. People with immune system problems, where their immune system doesn't work real well, make them more susceptible to get sepsis as well. But anybody at any age can become septic from just about any different type of infection that they can get. Some of the most common infections that we'll see at hospitals will be pneumonia and urinary tract infections. So, although skin infections and other types of upper respiratory infections can also lead to sepsis as well, they're a little bit less likely. With sepsis being so prevalent in our community, we at North Oaks want to be able to detect it at the earliest possible moment when people show up at our organization. Because of that, when you arrive in our emergency room, for example, our nurses and caregivers begin to immediately take care of you. They begin to take your blood pressure and your temperature. You may, in certain situations, start to have other types of blood work and x-rays and things done. These pieces of information are very important to accurately diagnose sepsis and have been among the standard of care for years across the nation. At North Oaks, we've taken an extra step now. We use our computerized electronic health record to collect the information that our caregivers are taking from you and that are coming back from our laboratory systems, and evaluate that information to look for signs and symptoms of sepsis. As part of that model, we're able to establish a patient's risk of sepsis, and that can be shown to our clinicians and is shown to our clinicians so that they can make better decisions about how to initiate treatment at the earliest possible time. Once someone becomes septic, time is really of the essence. You don't have a lot of time, and the earlier that we treat you, the better your chances are to have a full recovery. If left untreated, it's unlikely that people will survive sepsis at all. With that in mind, it's very, very important for us to begin the treatment the earliest possible time. Once you come into our hospital and once these notifications start to flow The providers may order certain things that are necessary for you to recover. Antibiotics, other types of fluids and things that you may need, other types of painkillers and analgesics, other types of blood tests that you may need so that we can more perfectly hone down exactly your problem and what illness is exactly causing your symptoms. One question we often get asked after that is, how is this working? The good news is we know at North Oaks today that with the use of our new computerized technology, there are people alive today that would not have been alive before, thanks to our early detection mechanisms and abilities to find out when they become septic at the earliest possible time. Just to go back and cover a few symptoms of sepsis, often people who are septic will start with a fever. They will often have some mental confusion. Sometimes they will have some significant pain, and it's not always located at the site of the infection. A lot of times it will be generalized pain. The confusion sometimes will be noticed by family members, and for that reason it's important that your family members also be aware of how to detect the early signs of sepsis. Once someone in your family starts to show some symptoms or signs, they should be taken to be evaluated as quickly as possible to their healthcare professional. Often people will come to doctor's offices or come to our emergency department with some early symptoms. That's very important because we're starting treatment at an early time, and that allows them the best chance for survival.
Dr. Robinson, we're getting some questions from our audience. Could you tell us, Pam would like to know, is sepsis contagious?
Yeah, that's a question that people often ask. Sepsis itself is not contagious. It's basically the body's immune response to an infection. So it's a condition that an infection is only part of the condition, but it's certainly the initiating part of the condition or what starts it. You can certainly catch sore throats and other things from people, but you can't catch sepsis from them. So even if somebody had, let's say, a type of infection in their lungs that led to them being septic, even if you had that same infection, the chances of you becoming septic aren't necessarily that great unless you also have some compromised immune function or have some other symptoms or some other problems maybe that have caused you to delay seeking care. So,
Abigail would like to know, what is the most common cause of sepsis?
The most common cause of sepsis in our population is respiratory infections, pneumonia, and urinary tract infections. That's pretty standard most places that you go. Less common are skin infections. People can become septic also after having certain types of operations, but that is pretty rare as well. So I would say mainly urinary tract infections and respiratory infections.
We have a question from Sarah. What is the difference between sepsis and septic shock?
Yeah, so sepsis is a condition where your immune system has this overwhelming response. Septic shock is a condition that progresses from sepsis. When a patient experiences septic shock, their blood pressure drops in particular, and that causes damage to the other organs, such as the liver, the kidneys, the brain. Because of that, we want to prevent septic shock. At North Oaks, we've been successful at treating sepsis early and preventing our patients from developing septic shock. Now, it can't always be prevented in all cases, but by early treatment, you can certainly reduce the progression to septic shock. Septic shock, if untreated, is certainly a fatal condition that we would not want anybody to experience. So.
Sort of a related question. Sana would like to know if sepsis can be cured.
Yeah, that's, I would say in terms of cure, yes, patients with sepsis can be cured. That is certainly true. A lot of times, if it's caught early, particularly before you develop septic shock, you can get a complete cure by treating the underlying infection and doing some other supportive things that we do. Once you've gotten septic shock, a lot of that damage that starts, damage to the kidneys, damage potentially to the brain, damage to some of the liver and some other organs, must be halted very quickly. Otherwise, permanent damage to those organs can result. But in general, we see that patients are cured of sepsis.
Okay, and Rhonda would like to know if you can recover from sepsis.
Yeah, so I guess going along to that, and those who maybe aren't cured in the sense that they're not, they don't take a medicine and aren't all of a sudden exactly well. Following that, and I'll talk about septic shock because that is more of a recovery process. We have patients certainly who are cured from sepsis virtually every day here and recover from septic shock as well. A lot of times they'll need other supportive things outside of our acute treatment and a little bit of long-term care to recover for some of those organ injuries, but that's still certainly a possibility and well within the spectrum, and we would expect that for those who recover.
Okay, and here's another one that you might be able to answer for us. What are the chances of surviving sepsis?
I would say that those who progress to septic shock, historically the numbers are patients that have severe sepsis or septic shock. It can carry up to a 50% mortality. So you're talking ranges that are pretty high once people get seriously sick. A lot of the outcome on your chances of surviving sepsis depend on those first few hours when you get sick, and also depends on getting to the emergency room or getting to the hospital quickly. It's very important to get to the hospital as fast as possible in patients who in particular are running high fevers, hurt very bad, and you're worried about their health. So the percentage of survival is going to be related to some extent how quick you get to the emergency room. Not all cases of sepsis can be cured, but certainly we've had success with treating a lot of people and treating a lot of cases that we've had people have some amazing recoveries.
Would you be able to say then if sepsis will go away on its own?
Yeah, I would say that sepsis on its own, I guess I'll answer that in two ways. One is for the patient, it will not. Without treatment, you're not going to recover. I would say as a disease process nationally and around the world, especially with the attention that's being brought to it through programs such as this, I think that we can certainly reduce the incidence or the number of people who get septic. We can certainly reduce the number of people who get septic shock, but it is going to be with us and be something that we treat and continually, much like some of the other things, like heart disease and different types of cancer.
Okay, and we have one final question for you. Can sepsis lie dormant?
I think that sepsis itself is not the type of condition that's lying there waiting to sneak up on you or attack you and all of a sudden show up. It's got to be related to other factors that happen to you that cause your body's health to change. And certainly those things can be infection. As we age, part of the normal aging process is our immune system itself is not quite as good as it is when we are younger, and that can be one of the factors as well. And also in very young people who've not yet been exposed to a lot of different types of diseases and don't have the same strength of immunity that younger adults do and older children, they are certainly more susceptible. But in terms of sepsis itself lying dormant, it's not a condition that would be lying dormant in someone that we would ever be able to detect or anything like that. So, I guess kind of in follow-up, I would say, for those of you who want to know more about sepsis, the CDC has an excellent website where you can get some more information. Also, your provider would be an excellent source of information as well. I would encourage you or your family members, if you should see someone who shows signs of symptoms of sepsis, to not wait, to seek a medical attention or additional medical information as soon as possible, because every few minutes counts and the clock starts ticking once people start to become septic. So I hope that was informative for you today, and as we go through the rest of the month, I'm sure you'll see some other programs about sepsis out and about, and hopefully you'll know a little bit more than you did when you started, and certainly know more about sepsis than maybe some of these other diseases that we probably won't see quite so much.